Hey y'all, today our NCLEX question of the day says, the nurse is planning care for a client who has been newly diagnosed with type 1 diabetes mellitus and prescribed regular insulin. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. So we're going to have multiple correct options here. Option 1 says to teach the client to rotate injection sites with each administration. This is going to be a correct option. Frequent injections like that can cause scar tissue, so we want to rotate that site. Option 2 says to instruct the client to limit oral intake if the capillary blood glucose level is elevated. This is going to be an incorrect option. We want a consistent intake of carbohydrates. We don't want like highs and lows there, so we just want to maintain a consistent intake. Option 3 says to remind the client that fruits and vegetables do not need to be included when counting carbohydrates. This is an incorrect option. Fruits and veggies are often like a really good source of carbohydrates. We definitely need to count them. Option 4 says to instruct the client to check the capillary blood glucose level before meals and at bedtime. This is going to be a correct option. Regular insulin is usually dosed like ACHS, so with meals and bedtime, and we definitely want to check our sugar before we give the insulin. Option 5 says to demonstrate to the client how to visually inspect the feet each day. This is a correct option. Our clients with diabetes are at risk for diabetic neuropathy and delayed wound healing, especially to injuries on the foot.